Hey guys, come along with me today to treat some upper face tox. As you can see, we are treating the frontalis, the glabella, and then crow's feet. So as you can see, I marked the patient's lateral borders on each side. I had my patient raise her eyebrows and then clench to make sure that I was over that true lateral border. Here I am working my way across the frontalis. My dots are about a nickel to dime size apart because when you have a little bit of diffusion, it's all going to blend together. My patient's dose was a lower dose, so I did make sure that I diluted the dose to standard dilution in order to make sure that I got a nice even spread all the way across the frontalis. Here I am having the patient turn towards me to make sure that I am in a comfortable position injecting, and I'm making sure that I am being precise on my injecting. Next, we're moving on to the glabella complex. So here I am injecting the procerus, which is responsible for that horizontal line on the bridge of your nose. Now I'm injecting the corrugators, the medial and lateral corrugators, and those are what are responsible for drawing in your eyebrows and creating those pesky 11 lines. So here I am being careful of my needle depth because on that lateral corrugator, your frontalis sits underneath it, and if you're going too deep, you're going to drop the patient's brow. Then we moved on to some crow's feet. This area has a lot of vasculature in it, so it's very important to be very gentle. Pull that skin taut and inject superficially. You don't want to inject too deep because you're trying to avoid other muscles laying underneath there, and you're trying to stay over that orbital rim for safety. As you can see, I am making sure that I'm over that orbital rim, and I'm also injecting up and away from the patient's eye. This is just making sure that you are injecting safely and keeping your patient's eye safe. As you can see, my patient has a lot of little creases in what is called the jelly roll of the eye. So I'm aiming towards that jelly roll superficially with tox in order to kind of treat those fine lines and wrinkles.